the DQIP2 tool. It's an informatics tool which is to identify patients who would benefit from a prescription review in simplest terms.
To tackle the problem of preventable drug side effects, which account for about 4% of all emergency hospital admissions.
We know that we can actually try and identify those patients, we can review their medications, understand if there's anything to be changed, perhaps sometimes there's a drug test that can be done, so a blood test can be taken to assess the levels of different drugs and actually make sure that it's safer for the patients. And it obviously, it gives reassurance to the patients, but it also gives reassurance to the professionals as well that they're taking good care of their patients.
The IT tool that we've developed really has three functions. First of all, it identifies patients who are at greatest risk of drug-related harm. Second of all, then it facilitates the review of these patients because it pulls together bits of information that are usually scattered in the medical record. It pulls it together into one accessible form, which will make the review process more efficient for GPs or pharmacists. And then it also facilitates practices to monitor whether they're actually improving their prescribing and whether the numbers of patients who are at risk of preventable side effects are actually going down.
The tool seems to be a good way of identifying high-risk patients and basically starting off with the highest risk and then working our way down, making good use of our time.
So what I would like practices to do is that GPs and pharmacists team up and think about how can they review these patients in a systematic way, and then for them to do it in a way that is then also acceptable to patients.
It's such a simple thing, and the patients would clearly appreciate it if we even just a little tick box at the bottom of their repeat prescription saying, look, I've looked at your medication, I think the combination is fine, I'm happy with it, and if you're happy with it, just keep taking them, Seems a simple thing, and seems to be something they would really value. Mm-hmm.
I think it will be superb for us who are very busy in our practices, prescribing for lots of patients, to actually be aware of the risks that sometimes we can actually cause to our patients. And as a way to find those at-risk patients to make sure that we are safe prescribers.